All right, what I have pulled up on the screen here, and everybody can hear me okay, I presume? Sound check. Yes, thanks, Heather. Yes, thank you, Catherine. Awesome.
Yes.
Yes. All right. Good. Sound check. Yesterday I did a WebEx and I'm talking and no one could hear me. So, and obviously, you know, I couldn't hear them. So, but we're good. We're all good. Okay. So what I have pulled up here, I want to show you a couple things. This is the electronic version of the Key textbook. And when I was talking about the blue boxes that are within each chapter, this I just specifically went to a random chapter, and I want to show you that what I'm talking about are within each chapter, you will find respective drug classifications correlated to the nursing process. So just like I was telling you, get used to studying your drugs through the nursing process, they're lined up for you this way in the textbook. So for the drug classification, adrenergic neuron blockers, this tells you what are the key things you as a nurse need to assess before you give the drug. What are some common nursing diagnoses that this drug is used for? What should your planning include? What should you be thinking about as the nurse taking care of the client? Nursing interventions. What are some of the things you should be doing? Patient teaching. And then they usually break it down into different categories. This one has general and patient teaching for self-administration and side effects. Certain cultural considerations, and how are you going to evaluate the drug, okay? So these are going to vary based on what drug it is that we're talking about. And Davis Drug Guide, it's lined up that it talks you through or takes you through the phases of the nursing process as well. So I wanted you to have that understanding of what I'm talking about when I'm saying study this in the form of the nursing process. In the Davis Drug Guide, when you go to look up a drug, there's a lot of stuff to read. Most common things in the Davis Drug Guide are going to be printed in bold. And what I can do here is I can show you the Davis Drug Guide while I'm in my ebook screen here. So this is Davis Drug Guide that I have electronically. You probably have a phone as well. If you have the app book, great. I believe that this is more an app that you guys get. A minute to load. We'll try not to push multiple buttons because it's now, but it's tempting. I don't want to. Try one more time, and if this doesn't work, then I'll have to come back to it later. Okay, so we have monograph. We're going to come back to this because for some reason it's not loading very quickly, and I want to be respectful of your time here. Saunders will work as well. That's another drug handbook. Yep, that's fine. It does not have to be Davis Drug Guide, but I believe you get access to it through your Skyscape app. Okay, I don't know what's going on. Oh, there we go. Okay, so we'll come, oh, now it's going to want to load. I'll come back to this. Let me take you to ATI. So this is the medication template that we want you using for the first assignment, as well as for an assignment that I'm going to introduce to you called Medication Tracker. This template goes through and it breaks down the classifications of what you should be learning about with each drug. Again, when you go to the resources, if there are 50 complications or 50 contraindications or precautions or 50 nursing interventions, pick the most common ones to fill in here, okay? Each of these categories, you know, expected pharmacological action is what we expect the drug to do. What is it used for? How is it administered? You can include the main route of administration and dose here. What are some of the complications? What are contraindications or precautions? Nursing interventions, interactions with other medications or foods or herbs, evaluation, how are we going to evaluate to know that it's effective, and what should we be teaching our clients about? This is the best way for you to study these drugs, and as we move forward in the course and we're working on these medication sheets, we'll also do little exercises where I may say in class, okay, get in small groups, explain one of your medications to your partners in your group, because being able to talk about it makes you understand and retain it better as well. And the question that's in came in from Gwen, and yes, Gwen, this is what you are okay to do on flashcards as if you want to, as long as you're including all the categories that are listed on this sheet, okay? Whatever format you like, the key, the main thing is we want these handwritten, not typed. And I'll check with the other lab instructors on that. I'll clarify that. You know, sometimes I allow typing, but I think what happens with typing is that students cut and paste, and then they really aren't applying. So I'll clarify with the other lab instructors, and I'll send out a message on that. As of right now, plan for handwriting for the first one. The first ones you're turning in do need to be handwritten anyways, and then I'll get a message out. I'll check with the other lab instructors to see what they have told you already. I don't want to say. So the faculty keeps in close communication, knowing that you have different instructors teaching your lab and clinical. We all want to make sure, you know, try to keep the message consistent. So this is the ATI template. The other thing that is on your course homepage that I said I would talk about, let's see here. Some can get wordy. How do we know how much info? You just want to pick the key things, Kevin. Pick the main things that are pertinent, that are in bold, or the main things that seem applicable to the general client. But you're right. If you copied everything from every drug, it gets all molded together. We're looking for what are the most common things that are bolded, or the key teaching points, or the key. And then Gwen, she really does not know. She told us to follow. Okay, so certain lab instructors, you know, the faculty, this may be the first time that they're doing these assignments with you. So yes, I'll give clear direction. I just wanted to make sure that no other lab teacher told you that they could be typed. As of right now, handwritten, and I'll make sure that we're all on the same page for that. Okay, here we have, this is what you're going to be doing throughout the course. This is called your med sheet tracker. You will get time to work in lab on these. For lab next week, try to have week 1 and week 2 done, okay? Before you get to lab, you may get some time in lab to work on them, but this is how you're supposed to start chunking these out week by week, and then we'll be looking to make sure that you've completed them. So an ATI med sheet must be filled out. The instructions are on the top. this is saying use them in a binder, but if you want to do this on a drug card, like an index card format, you're fine to do that as well. These are to be completed by you, and the specific list is not a group project. So you're working them on your own. Reading the data, writing it, and recommunicating it is a good way to solidify and make sure that you're retaining and learning information instead of just memorizing it. So this is designed. This list was made by one of the pharmacology faculty as all the drugs that we talk about during the course. So this is a really great resource tool to have. And moving forward in your clinical setting, these are drugs that you're going to commonly see. So they're important to know. So those are the two forms that I wanted to make sure I explained to you. I do, oh, so there was some sort of bug on my script was why my Davis drug guide. So we're going to go stop script. And let's see if I can get into this before I totally sign out. There is a how to use the Davis drug guide. If you look in your table of contents in the Davis drug guide, I want to bring you to the point of, it's not going to let me load this right now. Drug monographs are the key areas that you look drugs up in the Davis drug guide. And this is where you're going to find your information that you need for your drug cards. The template sheet. Yes, the template sheets, the ATI, over the course of this class, you will have one of them completed for each drug listed on the medication tracker that I showed you. The medication tracker is a list of drugs that, and I'm sorry, I should spend more time on that with you. I guess I wasn't sure if students looked at it ahead of time, or let me open it up again here. This is it's called the medication tracker, and you will be using this. I'm introducing it today, but it'll be built upon during your forthcoming weeks of the course, where each week during lab and even outside of lab time, you will be making drug cards that go with these medications. And you'll have time, you know, our lecture isn't going to take up the whole time today. You'll have some time where you can get started on these, but you're filling out one of the ATI templates or a drug index card, whatever terminology you want to use, for each of the drugs on this list. These are the drugs that we will be covering throughout the course of our lecture time. So this is just getting you in tune to that as well. Does that answer that question, Gwen? Okay, great. You're welcome. All right, let me see if I can close this down. So I want to see if I can take us to, I believe Tylenol, I'm thinking was on page 98, and I want to show you a little bit about navigating a drug guide. Let's see if we can get it to take us there. I'm not having luck with this drug guide. What the drug guide does is it takes you through each of the general categories that I had explained to you in the PowerPoint, and it tells you the information about the drug. I was going to try to pull up Tylenol so that I could use a common book to show you, but at least for teaching purposes, I can show you that under each drug, it is broken down into the categories that you'll find on your template. So you're going to see what's it indicated for. What is the action of the drug? There's something that's not running right in this window at this time, so it's not allowing me to scroll, and I don't want to waste time. So I'm going to close this because like locking everything up for me. Not good. Well, up. Could be the storm. Lord knows. Oh, I'm cutting out. Oh, so the audio is not working either. Okay, we're having technical challenges. Let me try and see. Okay, I'm going to keep on. Let me know if it's any better. I'm not quite sure. It could just be, it's a technical thing that I'm not able to repair right now. So this PowerPoint talks about understanding drug classifications, and a lot of this, when you're going through the Davis Drug Guide, these are the key bold printed things that you'll see in respective categories when you're looking up your drugs. Drugs can be classified by their therapeutic use, such as antidepressants. They're used to help with depression, so that's their therapy. That's what they're used for. Or by their pharmacologic profile. So how do they pharmacologically do? Well, there are classifications of medications that are used for depression, which are antidepressants, but they work by inhibiting the reuptake of serotonin and reuptake inhibitors. So the purpose of this is just to let you know drugs can be classified by what their therapeutic use is or by their drug profile. Most textbooks combine a combination of the two classifications, and healthcare workers use both terms when they talk about them. Other medication or classification methods can include perhaps how is it classified by what we call the schedule of controlled substances. This is for like our drugs of high abuse potential, such as narcotic pain medications. They're classified by schedule of controlled substance, which we will cover in our opioid discussion. Therapeutic classes are broad categories based on what the drug is supposed to do. What's the therapy intended? Anti-anginals, they're going to stop angina or chest pain. Sedatives, they're going to cause sedation. Analgesics, they're going to stop pain. These are broad examples, broad categories of therapeutic classes. Therapeutic classes can have several pharmacologic classes. So the big class, therapeutic class of antihypertensives, they help with high blood pressure. There's at least 13 pharmacology classes within that class. So we learn these drugs by classification, and learning about the classifications can help you group together some of the key things that you need to know for different classifications of drugs. So drugs grouped by therapeutic class work in different ways. They're not similar, and they have different mechanisms of action. However, the therapy of them is the same. So a therapeutic class is useful when talking about them in a big way, like antihypertensive drugs save lives, or you would say antihypertensive drugs lower blood pressure. You will need an antihypertensive medication. Within the classification of pharmacology classes under antihypertensive, pharmacology classes are based on a mechanism of action and includes drugs that have similar mechanism of action. So an example, ACE inhibitors are examples of a type of antihypertensive. ACE inhibitors tell you how the drug works. Well, they inhibit the enzyme that converts angiotensin 1 to angiotensin 2. We'll talk about that in our cardiac lecture. But the ACE inhibitors have the same or similar mechanism of action within a class of antihypertensives. So the pharmacology class describes the drug's properties in a specific way, and they're necessary when determining a treatment. A nurse might say an ACE inhibitor is more desirable than the class beta blocker. Your heart won't race as much because the beta blocker prevents beta adrenergic receptors in the heart from being stimulated. So the pharmacology class is giving credit to the specific way that the drug's properties are going to work. We've already talked about generic names. One of the things with generic names of drugs in the same pharmacology class often have the same suffix. Okay, so beta blockers are a type of medication used for hypertension. So pharmacologic class of medication in the therapeutic class of antihypertensives and in OLOL. So many drugs that are beta blockers, their generic names are metoprolol, atenolol. So you'll learn the names when we get to cardiac medications that you can help to learn them by their endings. Here we have some other clues to different drug classes. When we learn about these drug classes, pharmacologic classes, we'll talk about the way they end. But benzos, there's lorazepam, diazepam. They have identifying suffixes, and we'll learn more about these when we break them down in the respective categories. So drugs in a pharmacologic class have similar attributes when it comes to talking about what are they indicated for, what's their mechanism of action, what are they contraindicated with, and what are the precautions. These attributes are similar or identical in pharmacologic class. If you know about one drug in a class, you'll have some knowledge about other drugs in the pharmacologic class. Where they may differ is in their dosing, some of the contraindications or precautions, some of the onset of their action profile, such as the onset, duration, and peak, and the availability. This is, I was thinking this slide was going to come earlier in the presentation, but here's an example of a pharmacologic class of ACE inhibitors, which fall under the therapeutic class of antihypertensives. They're medicines. All of these medicines can be used for high blood pressure. They all work by the mechanism of action as an ACE inhibitor, but within them, there are at least 10 individual drugs. You'll note they all end in pril. So we have all these, captopril, enalapril, lisinopril, quinapril. All these drugs are examples of ACE inhibitors. And as we move through each lecture throughout our weekly modules, we are going to learn drugs by classification, and we're going to teach you what are called exemplar drugs to help you learn the main prototype of a drug for a pharmacologic class. And then many times it's easier to learn the outside, the exceptional drugs, by how they're different. And this will make more sense to you when I'm able to apply it. The purpose of this was to show you how to navigate through and know some of the terminology in the Davis Drug Guide. Any questions thus far? It's still breaking up, or it sounds better? Better, good. Davis Drug Guide is accessible, from my understanding, through the Skyscape app. So in your email, you should have gotten something from the bookstore, I believe is where it comes, that should be directing you on how to get access to the app. So yes, I am getting confirmation that it is in Skyscape, and it should have come in your email. On how to access Skyscape. Okay. If you need help, you can reach out to the PSC for anything with regards to that app. All right, what I'm going to do then, I wanted to go into API, not this API. I want to show you a few more things to help you navigate. API. My screen looks different than your thing, but I will log in and show you a few things that I think are key resources I want to make sure you know about. I like your platform better than we have the old platform. I understand they'll be updating the teacher's platform very soon, but I like yours. Thanks. Catherine just posted the app in Skyscape. Thank you. or the app course Seth gave in the chat box, the link to it. Thanks. In your resources, and again, I believe yours populates already for you, where it'll have the review modules. But if we go, mine I have to open manually here, 2016 edition. I believe your pharmacology book is, if you go into your RN review modules as one of the tabs on your ATI dashboard, you'll be able to access your book. But what I want to bring your attention to is here, Pharmacology for Nursing RN. This, when I'm talking about the ATI textbook, is what you should be looking at. And each of these chapters aligns to the chapters that I have on the course agenda. If in the book, click on it and it'll take you to the respective chapter usually. Okay, I'm making a fibber out of myself. Okay, well, sometimes this is hyperlinked and it'll take you right to the right chapter. But anyways, they're broken down for you on the agenda as to where you would be looking for these. I know when you're doing your focused review, it takes you to the chapters. Obviously, my access does not. But please make sure you're aware of accessing or knowing how to get to your ATI pharmacology resource, because this is a great resource to have. All right, I wanted to make sure I showed you that. So let me drop that down and get that out of there. And then I was going to show you, we were going to talk about the week 2 assignments. And I want to talk to you about the quiz. So let me go to the course and I'll pull up the quiz. I want to just give you a little bit of direction on the best way to approach that. This is running really slow. So we're calling it a search challenge because obviously you haven't been exposed to the material regarding the drugs that are in here. So this was made as a navigational tool. For your readings coming up for week 2, you're going to be reading about these different classifications of medication. So much of your reading is going to help you answer these questions. What you're doing is you're looking through your key textbook. You can also, some of this you can find in Davis Drug Guide. I suggest for the cholinergic, adrenergic blockers, and anticholinergics, you're using the material from the key textbook that you're reading for next week's lesson to answer these questions. And what you're doing is you're choosing one of these categories of medications, this classification, the A, B, C, or D, and you're plugging it into the box here. There's only, each of these is used once for the respective answers underneath. So I would suggest for questions 1, 2, 3, 4, 5, you are using the key textbook reading material for next week, okay? For this, the question is, are you turning it in for grading or turning it in online? As of right now, they're not set up for online format. You can turn it into me and I'll enter scores into the grade book. Bring this to class for lecture next week because we'll work on it a little bit then too. If you have it done, you can scan it. I am fine. I can open up a Dropbox as well, but to make it easier, I'll also I can collect them in class. And we're going to work on them in class too. So bring it to class as well next week. When you have a question like number 6, it's saying which of these should the nurse question? This question is asking you to go into a resource like the Davis Drug Guide and look up each drug and find out, oh, is 20 milligrams orally, and you'd have to know what TID meant. It means 3 times a day. Is that a dose that is acceptable for urine retention? So it's challenging you to look these drugs up in a drug resource and find out, is this okay? Is this too high? Is this too low? And is there something wrong with the way that this is telling me to give it? And you're questioning to see which of these might not have something 100% correct in it. Same thing for these drugs here. The dopamine analogs, neuroleptics, opiates, NSAIDs. Use your key textbook in your reading to help answer these, because what you're doing is you're learning about these in the upcoming readings, and then you're answering the questions. Again, one choice applies to each of the drop-down boxes. So I would say key text is going to be the easiest, just extrapolating that from your reading. When you have a question like this, use drug guides to look up each of them, find out, are these okay? I suggest using the readings, because on your readings, or when I'm saying readings, you can also use the ATI book. It's going to help with this as well. I just know that some of these specifically, they align with what's found in your key text and they align with the reading. So either resource is fine, but here it's that when you're reading about these classifications of medications, you're able to pick one of the following, choices and apply it to the classification of medication. Here's another one where you're going to look up doses and find out, in addition to the dose, how's the route, how's the frequency, how's the timing, is it correct or not? And here's another set of questions, 16, 17, where you're going to look at the different classifications from the reading. These are specifically, you can use the key text or a drug guide. You're going to look up the drug and you're going to find out, okay, what condition, what's it indicated for? What is the indication? What condition can it be prescribed for? This, you're going to put some thought into the stages that we talked about with regards to the absorption, distribution, metabolism, and elimination, which when you read about these in the text, it talks about underlying medical conditions that can affect each aspect of the kinetics, the pharmacokinetics. And then this is specific to the talking about the first pass effect. So just giving you a little suggestion, go ahead and work on these and bring them to class. And then I think we'll probably, we'll definitely may divide you up into small groups to go over them. I'm a firm believer that talking about your learnings makes you understand and retain it better. So a lot of things we do, you'll be broken up into small groups where you're talking about some of the things you learned. So that should give you an overview on that. Again, this is multiple submissions, so we'll review them. Everybody should be getting to what they need to achieve on this, but I want everybody to, try it and see what you think and use it as the tool that it's intended to be to get you navigating through your literature and your Davis Drug Guide or your other ATI information. Any questions on that? I wanted to show you, we'll talk about Module 2's assignments, if there's anything I can support you on and give you insight there. And then I think that's everything that we were going to cover today. We are almost done. So let's go to the agenda. I don't know if I closed that before. Yeah, it looks like I did. I got to open the agenda again, and I'll show you. Well, actually, you know what? I'll just go into the module. That's even going to be more appropriate to go into the module and show you what to do. So 1F. Oh, no, that we're all. Sorry about that. Okay, module 2, you have your assignment, so I can give you some support there. It's giving you a medication type, and it gives you a proposed situation where an ethical dilemma or an ethical concern may arise. You are going to pick one of these classification or choice of medication. They're giving you an example of a medication from a respective classification. So, like here we have aspirin. It comes from the classification of a non-steroidal anti-inflammatory drug. Consider the vulnerability of elders due to over-the-counter affordable nature of this analgesic. Why could that be a problem? So you're going to think about, a medication that is affordable, easily accessible, taken by a population of a client that might have some vulnerability, that's a hard word to say, and why might that be a problem? And pick one of these of your choice, and you're going to invent a scenario where giving the medication could result in an ethically or legally charged situation. You're going to post a little summary of that in the discussion post. You're going to include an in-text citation that you use to get your drug information on, as well as include a reference to that. So I'll post a little blurb on how you incorporate in-text citation and references when you refer to outside sources. Because you writing about this drug and why a client can be vulnerable, you may know some things off the top of your head, but this is designed to get you into your resources and have you read about it and find out why this could be a problem. Catherine is asking a minimum word count. I don't really put a minimum word count on it. Just enough, sufficient detail to where you are showing me that you gained knowledge and really put thoughtful response into the question at hand. And for the responses for this, I'm just requiring one. Okay, so you're going to make the initial post, and then you're going to respond to at least one other student's post. If you want to respond to more, that's great. The response should be more thoughtful than, oh, I like that. I agree. Great job. You're taking the material that you read and you're expanding upon it, either by sharing something it made you think of, something that you learned that was similar, or something that was different. But you're putting thoughtfulness into your response as far as insight and new awareness or new reflection, instead of just agreeing to it or saying, great job. And then I will work on getting the Module 2 quiz either uploaded or possibly, if I can get it in the format, we just got new format of the quiz sent out, where I'm going to see if I can try to get it electronically loaded. If I can't, I'll send it on the course announcements for you to print out and complete that way as well. The question came up, do we need references for the reply? If you are referring to outside information that is not your own, yes. So if you're expanding about maybe a personal experience that you had, you don't necessarily need a reference for that. Or a personal, you had a family member who wound up in that situation and this is how it was handled. That doesn't need an reference or an in-text citation. But if it's something that you are strengthening or supporting from data from an outside source, yes, please make sure you include an in-text citation and a reference. So that's the discussion, and have fun with it. It's to allow you to, pick something and learn a little bit about it, of how it could be taken in the context of an ethical or legally charged situation. So that is all that I had on my agenda. Anybody have any questions? If you think of something outside of this recording, please send me an email or post it in the general course questions, and I will respond to it. I appreciate you taking your time to go through this. I wish we could have had the live, class today, but we knew what was going to happen or what the weather was going to be like. So keep in communication, and I look forward to meeting you all on campus next week. Thank you.